So we looked at the stomach and we looked at the autonomic nervous system that supplies the stomach and how parasympathetic and sympathetic fibers control it. Well, again, the small intestine is controlled by these autonomic fibers, these parasympathetic and sympathetic fibers, which we can see here. We've got the blood vessels left on, and in green, you can see this spiraling mesh, this cobweb of autonomic nerves. Again, we'll look at these in more detail later on, or the individual organ lectures become very detailed and complicated. So we'll look at the autonomic supply altogether in a later lecture. But simply, again, the parasympathetic is going to have the effect of increasing the activity of the small intestine. So it's going to increase the peristalsis through the small intestine. It's going to facilitate blood passing towards the small intestine, allowing for the nutrients to be absorbed. And this again is done via the vagus nerve, the parasympathetic input, specifically the posterior trunk. Sympathetic is going to be associated with decreasing activity. So for example, if you're running a marathon, you want to direct that blood to your muscles so they can carry out their function. You don't want to have a lot of blood passing to the small intestines. You want to direct that blood for oxygen, for nutrients going towards the muscles. So the sympathetic part of the autonomic nervous system for the small intestine is going to reduce its activity. And this is carried out again by some splanchnic nerves, greater, lesser, least. We'll look at those in later lectures in more detail. And they form what's known as the superior mesenteric plexus. This is a hub of nerves that surrounds the superior mesenteric artery. And these nerve fibers pass towards the small intestine via the arterial supply, and they're so-called periarterial branches.